Australia needs a national suicide prevention strategy because we essentially need that roadmap, I guess that framework for our suicide prevention system, and a changed approach to how we look at suicide prevention over the next 10 or so years, where we can truly look upstream at prevention and also at our support services, and also about what underpins those things to ensure we have a really well-rounded suicide prevention approach across the next 10 years in Australia.
I think Australia needs a national suicide strategy for everyone, because we were a family that for 10 years plus we're trying to seek support and get help in a system all over Australia, actually, and it was so disjointed and so hard to navigate, and sadly it's worse now than it's ever been. So I think Australia collectively, we need to get a strategy that states and all governments can buy into and try and get a continuity of support and care for everyone that needs it.
Australia needs a national suicide prevention strategy, and a strategy about suicide prevention. As we see, the rates of suicide are increasing. It's a significant and really distressing issue that affects everyone. And also, we know it's one of, if not at times, the leading cause of death, unfortunately, for many people in our communities. And beyond that impact, it affects not just the people who attempt to end their lives by suicide, or the ones who unfortunately do end their lives by suicide, but also the families and the communities in Australia, collectively.
The Lived Experience Partnership Group has been involved every step of the way in the development of the strategy. It was really about a 15-month process of looking at multiple kind of iterations of the draft document, and really unpacking what that was, what the actions were, what the objectives were, and how we could really, I guess, embed lived experience at the heart of the strategy along the way.
I am part of the LEPG, the Lived Experience Partnership Group, and I'm very proud to be part of that. It has been such an honour and a privilege to have been there throughout the entire writing, really, of the strategy, and we have been able to share our experiences, give our opinions, and be able to really buy in to all sorts of things that are important to us as individuals. And that's been incredible, listening to other people's lived experience and their voices, and the people at the National Suicide Prevention Office, their expertise and their experience, to all work together to try to formulate something that is for everyone.
I would say we've played a pretty critical role across every aspect of the development of the National Suicide Prevention Strategy. I wouldn't even say just the development. When we talk about like the discovery, the production, the thought processes, it's important to understand that each of the Lived Experience Partnership Group members doesn't just represent themselves or their own lived experience. They represent the diverse voices of the many people the communities they come from, their cultural backgrounds, sexual and gender orientation. There's so many different ways. In terms of that practical way that we've been there and involved is the advisory role. We bring those lived experience perspectives to all the high level discussions. Also just in all of us advocating for the different community led approaches to solutions, and really just across the whole co-design of how it looks. I think there's probably not a bit of the strategy that the lived experience hasn't advised on.
The three domains of the strategy are critically important. They all play an essential part. If we look at the critical enablers first, without them, without things like governance, embedded lived experience, research and workforce, the whole, I guess, approach wouldn't really work. Really importantly, we have prevention in there, which is looking upstream, which is really quite unique in a sense. We're putting the prevention back in suicide prevention. So we're looking at what may cause people to get to suicidal distress in the first place. And then really importantly, looking at support and how people can be supported when they need to be as well.
The three domains in the model are equally as important. I think everyone individually perhaps has a not a preference, but something that really speaks to them more than anything. For me, it's about support. That's what I think is mostly needed, but I think all of them are equally as important and need a consistent and very thorough plan.
suicide is not an easy thing to sort of put down to 3 domains, or 3 areas, or 5 indicators or something by any means. But what we understand with suicide at the moment, or again, speaking largely from my perspective, is what we are currently doing isn't working, and or at least isn't decreasing, unfortunately, the high rates of people ending their lives by suicide. And what we see is really different communities have really, really diverse needs. So in looking at these 3 domains, so in looking at prevention, support, and critical enablers, or if you want to sort of layman's terms, what's going to enable this to happen? How does this actually occur? All the different communities that are affected in different ways have different needs, whether it's geographical communities, whether it's non-geographical communities related to your identity, for example, your political, religious beliefs, your cultural background. I think it's really important to also understand prevention. How do we prevent people, on the social level, social determinants? How do we stop people from getting to the point, that they feel distressed? Because suicide is not just mental health. It's not a mental health condition. We can't medicate social issues.
There is a link with suicide and things like mental health, but there's also people that reach suicidal distress that don't have a mental health problem or don't reach out for mental health supports. It may be more linked to housing problems, relationship problems, a range of social and economic problems. So if we don't address that within the strategy and within our approach, then we're really not, in a well-rounded way looking at suicide prevention fully.
If you can fix up or address issues so that people don't go down that path, that's unbelievably important. And it's individual, but it's also very common. So there are common life stresses that for many can cause then a suicidal distress situation. And it's not always about mental illness. In fact, it often isn't. And reaching a suicidal crisis yourself, and I've been in that position, it's not on your bucket list. It's not something that you plan to have, but sometimes life throws curveballs at people.
This is to my perspective, not to the perspective, obviously, of the office or, say, for example, of my other lived experience partnership group members. But I think that there was a recently, the development paper that was put out on the outcomes framework, outcomes map. Unfortunately, we need to look past, not saying that we forget or we move past, the people, unfortunately, that lose their lives to suicide, that end their lives by suicide. But suicide cannot just be treated as or be viewed as suicide is when someone has ended their life. We need to look at suicide as suicide prevention more broadly. We need to okay, we know people are ending their lives. It's distressing. It's sad for those people and their families. How do we move on from that and put, the prevention back in suicide prevention? I've heard a few people say that, but we've got to look at things like we've got to look at, as much as I'm not a political and economically minded person, you've got to look at the economics. You've got to look at education, cultural factors. Suicide prevention can't just exist in health. It can't just exist in mental health. We need to be looking at all the other government departments, organizations. If someone's interacting with another service, organization, or again, I come back to the saying, you can't medicate social issues. You can't provide therapy for a social issue. So we need to address the drivers of suicide.
What's different about the strategy is the approach of looking upstream. So we really are putting prevention back into the suicide prevention area in a really deliberate way. So we're looking at what those factors are, what the influences are that may bring people to get into suicidal distress in the first place. And that's a really key part of the approach.
The strategy will hopefully give a cohesive and consistent and fair way of moving forward to absolutely reduce the suicide numbers, but also to be able to provide equity and help people who, through circumstances beyond their control, whether it's being homeless, whether it's being stuck in trauma, whether it's being in a domestic violence situation or an unemployment crisis, the strategy will benefit anyone in those situations if the governments buy in and if the supports are put in place.
What is the current approach is the question I would pose to, how is this strategy different to what is already? Well, the thing is, Australia doesn't have a national suicide prevention strategy, which quite literally seems just so strange to anyone. If you say, we see other countries, reference so many other communities and countries in the work of the NSPO and in the development of this strategy, is we see lived experience at the core of many things. All right, maybe states have their own, with New South Wales development of suicide prevention legislation, etc. But the lived experience is at the core of all of the national suicide prevention strategy and within the office's work.
I believe the strategy is incredibly comprehensive, and I think if ever it's criticised in terms of blue sky thinking, I think that that's exactly where it should be, because we have to aim really high. And I think everyone recognises that in a utopia, no one would, reach a suicidal crisis and everyone would be able to access everything. But this is a strategy that people can look at and know what to aim for and know what has to be put into place. So I love the fact that it aims really high and that it really tries to speak to all communities and all people. And to me, it's for everyone. It's not just for a certain part of the population. It's for young people. It's for the elderly. It's for culturally diverse people. It's actually for everyone. And I'm really proud of it. I think they've done a stunning job.
It's really important that public consultation gets everyone at every corner. And importantly, we need people to be visiting the hub, the website, providing their thoughts, their input and their feedback, and being honest and critical about what we need. Now, there's many different ways this is being done, for example, through different channels, peak bodies, organisations, but obviously through the National Suicide Prevention Office.
So really importantly, the strategy is out for public consultation, and that public consultation period is open until the end of Sunday, the 27th of October.